If your child's nose seems to be running almost every day, especially if it has lasted for weeks or even months without stopping, you are not alone. Many parents struggle with this same problem. Most people think it's just a cold or it will go away on its own. But a constantly runny nose is not always a simple cold. This condition can be a signal from your child's body that something is wrong. Today, we will explain this topic clearly, simply, and in an easy-to-understand way. We will talk about why children have a constantly runny nose, the main causes, when it becomes a concern, what can be done at home, and when it is important to see a doctor. First, let's understand what a runny nose actually is. Inside the nose, there is a special lining called the nasal mucosa. Its job is to moisten and warm the air and to trap dust and germs. When this lining becomes irritated or inflamed, it produces extra fluid. This is what causes the nose to run. The first and most common cause of a constant runny nose in children is allergies. This is known as allergic rhinitis. In this case, the child's nose runs even without having a cold. The nasal discharge is usually clear. The child may sneeze frequently, feel itching in the nose, and have watery eyes. This can be triggered by dust, pet hair, pollen, mold, or certain smells. Allergies often become worse in spring and fall. Children with allergies may also sleep poorly at night, breathe through their mouth, and feel tired more easily. One very important point is that antibiotics do not help with allergies because allergies are not infections. The second very common cause is enlarged adenoids. Adenoids are lymph tissue located behind the nose, and in children, they can become enlarged. When adenoids grow too large, they narrow the nasal passages. This makes it difficult for mucus to drain properly, causing the nose to run constantly. These children often breathe through their mouth, snore at night, and may have frequent ear pain or ear infections. Their voice may sound nasal, as if they are speaking through their nose. The third cause is dry air. Many parents do not pay attention enough to this. During winter or in rooms with air conditioning, the air can become very dry. Dry air irritates the nasal lining, and as a protective response, the body produces more mucus. As a result, the nose may run or become congested. This is especially common in young children. The fourth cause is chronic nasal inflammation. If a child catches colds frequently, the nasal lining may not have enough time to heal completely. Over time, this inflammation becomes chronic. In this case, the nasal discharge may sometimes be clear and sometimes thick. The child's sense of smell may also decrease. Now let's talk about what can be done at home. Keeping the child's nose clean and moist is very important. Rinsing the nose with saline solution is one of the safest and most effective methods. You can use ready-made seawater sprays from the pharmacy or prepare saline at home using warm, boiled water with a small amount of salt. Humidifying the air in the house is also very important. If possible, use a humidifier. If not, placing a bowl of water in the room can also help. Make sure your child drinks enough water because dehydration dries out the nasal lining. If you suspect allergies, reducing dust in the house is essential. Clean carpets regularly, limit soft toys, and ventilate rooms often. If there are pets, it is best to not allow them to enter the child's bedroom. Nasal decongestant drops should not be used for long periods. Many parents rely on these drops, but long-term use can damage the nasal lining and make the problem worse. Nasal drops should only be used for short periods and with a doctor's recommendation. A child's overall immune system also plays a big role. Proper nutrition, enough sleep, and regular outdoor activity help reduce nasal problems. Giving very cold drinks or too many sweets can make nasal symptoms worse. When should you definitely see a doctor? If the runny nose lasts for longer than a few weeks, if the discharge becomes yellow or green, if the child sleeps poorly at night, has frequent ear pain, or if their general condition worsens, it is important to see an ENT specialist. If adenoids or allergies are diagnosed, the doctor will create an appropriate treatment plan. Most importantly, remember this: a constantly runny nose in a child is not something to ignore. If left untreated, it can lead to hearing problems, poor sleep, and negative effects on a child's development. But when the right steps are taken early, this problem can be controlled and the child can grow up healthy. Observe your child carefully and do not ignore the signals their body is sending. A healthy nose means a healthy breathing, healthy sleep, and a healthy child. If you found this information helpful, share it with other parents. Healthy children mean a healthy future.